The vast majority of people remain completely unaware that pancreatic cancer stands as one of today's most lethal malignancies, silently surpassing both breast and prostate cancer in mortality statistics across countless nations worldwide. What proves even more deeply concerning is how this devastating disease continues to operate beneath the public radar, attracting minimal awareness despite its steadily climbing incidence rates and increasingly alarming impact on families everywhere. Picture this scenario. By mastering just a handful of essential warning symptoms, you could potentially help yourself or someone you cherish identify this illness before it reaches a critical, untreatable stage. There exists a completely valid reason why medical professionals and researchers consistently refer to pancreatic cancer as the silent assassin of modern medicine. Maintaining a 5-year survival percentage hovering around a mere 12%, this disease demonstrates exceptional skill at concealing itself within the human body, claiming more than 65,000 precious lives annually throughout the United States alone. The truly frightening reality reveals that nearly 80% of patients consistently dismiss initial warning indicators, treating them as trivial health concerns or routine daily discomforts until the malignancy has already progressed significantly and begun metastasizing to other vital organs. However, here lies the absolutely vital piece of information that could change everything. Current, cutting-edge research consistently demonstrates that numerous symptoms begin manifesting anywhere from 3 to 6 months prior to official medical diagnosis, creating a precious opportunity window for prompt identification and potentially life-saving intervention. This window of opportunity represents the difference between hope and despair, between treatment possibilities and terminal prognosis. Understanding these early signs isn't just medical knowledge. It's potentially the key to survival itself. Despite being relatively compact and concealed deep within your abdominal cavity, your pancreas performs absolutely tremendous responsibilities that are essential for your daily survival. It assists in controlling blood glucose levels with remarkable precision and generates essential digestive enzymes that break down everything you consume. Due to its concealed anatomical position, malignant growths can develop completely silently without causing immediate alerts or obvious symptoms, making the recognition of subtle warning indicators increasingly crucial for early detection. The pancreas sits nestled behind your stomach, surrounded by other vital organs including the liver, gallbladder, and small intestine. This strategic location allows it to function effectively, but also makes it incredibly difficult to detect problems until they've progressed significantly. Throughout this comprehensive presentation, we'll systematically uncover 8 unexpected indicators of pancreatic cancer that might genuinely surprise you, some being so prevalent and common that they're frequently ignored completely by both patients and healthcare providers. Here's the revolutionary medical discovery that could save countless lives. Based on recent comprehensive scientific studies, identifying merely 3 of these symptoms in combination could enhance early detection chances by approximately 70%. What causes such a consistently fatal condition to remain so tragically neglected in public health discussions? Why doesn't this life-saving information feature prominently in routine health conversations, school curricula, or public awareness campaigns? The answer lies in a combination of factors: the disease's rarity, its rapid progression, and the subtle nature of its early symptoms. Should you find this content valuable and potentially life-saving, remember to appreciate this video and subscribe for continued updates on health subjects that can genuinely impact lives and save families from devastating loss. Knowledge shared is hope multiplied. Let's begin our detailed exploration with the initial crucial indicator. Sign number 1. Comprehensive digestive complications. Pancreatic malignancy possesses the devastating capacity to severely disturb your entire digestive mechanism through multiple interconnected pathways that cascade throughout your body. The pancreas maintains an absolutely primary function in digestion, creating essential enzymes including lipase, protease, and amylase that assist in decomposing fats, proteins, and carbohydrates into forms your body can absorb and utilize for energy and cellular repair. When tumors form within or adjacent to the pancreas, they can significantly disrupt enzyme creation or completely obstruct pancreatic ducts, triggering cascading digestive complications that prove both uncomfortable and genuinely worrisome for patients and their families. As digestive functioning progressively deteriorates, food may linger in the stomach without proper breakdown, resulting in ongoing nausea, persistent vomiting, uncomfortable bloating, and general digestive disturbance that affects quality of life. Eventually, this systematic disruption produces noticeable appetite reduction as the body increasingly battles to process nutrients effectively and efficiently. This frequently causes inadvertent weight reduction, progressive muscle deterioration, and serious nutritional shortages, further compromising overall bodily strength and immune function. Patients often describe feeling weak, tired, and unable to maintain their previous energy levels. One especially revealing indication of compromised digestion involves distinctive stool appearance changes that many people find embarrassing to discuss. Since the body cannot adequately break down and absorb dietary fats, bowel movements may appear unnaturally pale, noticeably oily, and exceptionally malodorous, a significant warning sign that's often disregarded or attributed to dietary changes. This transcends minor digestive irritation. It represents the body's desperate method of indicating deeper, more serious problems requiring immediate medical attention. Recognizing these digestive alterations as potential pancreatic cancer warnings could prove absolutely life-saving for you or your loved ones. Sign 2. Profound exhaustion and physical debility. CC0 in 04.19. Pancreatic cancer can systematically deplete bodily strength in ways extending far beyond ordinary tiredness or normal fatigue. This differs dramatically from exhaustion experienced after hectic days, poor sleep, or strenuous physical activity. It manifests as profound, unrelenting exhaustion that persists regardless of rest amounts, sleep quality, or lifestyle modifications. Even following complete nighttime sleep lasting 8 to 10 hours, you may awaken feeling as though you barely rested at all, with energy levels remaining consistently low throughout the day. This isn't temporary tiredness. It's a fundamental change in your body's energy production and utilization. Internally, aggressive cancerous cells compete directly with healthy cells for vital energy and nutrients, gradually depleting your body's carefully maintained reserves. Basic daily tasks like walking short distances, climbing stairs, or lifting lightweight items can suddenly become overwhelming challenges, transforming everyday existence into constant physical struggle. Beyond the obvious physical impact, this debilitating weakness often accompanies serious emotional difficulties, including persistent feelings of sadness, anxiety, frustration, and hopelessness. Many individuals also experience significantly disturbed sleep patterns, which intensifies exhaustion and creates vicious cycles of both physical and mental stress. This cancer-related fatigue's primary danger lies in how easily it's mistaken for common conditions like chronic stress, natural aging processes, or simple overexertion from busy lifestyles. Unlike normal tiredness, it doesn't respond positively to rest, relaxation, vacation time, or lifestyle changes. Instead, it persists stubbornly and gradually intensifies over weeks and months. Recognizing this stubborn, unshakable exhaustion becomes absolutely essential for seeking prompt medical attention, as it may provide among the few early detection clues available for this silent disease. Sign number 3. Temperature fluctuations and persistent chills. Fever accompanying pancreatic cancer frequently indicates your body's inflammatory response to the progressive disease process. When pancreatic inflammation occurs due to tumor growth or tissue damage, it systematically activates your immune system's natural defense mechanisms, triggering complex biochemical reactions throughout your body. These temperature variations prove particularly confusing and concerning because they intermittently appear and disappear without clear patterns. You might experience distinct episodes of intense coldness and uncontrollable shivering, followed by periods of high fever, creating a roller coaster of physical discomfort that's difficult to predict or manage. This irregular pattern differs significantly from steady fevers typically accompanying common infections like influenza or bacterial illnesses, which usually follow predictable courses and respond to standard treatments. The combination of jaundice and pancreatic inflammation creates perfect conditions for these temperature irregularities. Your body essentially battles on multiple fronts simultaneously, managing bile duct obstruction, tissue inflammation, and cancer cell proliferation all at once. This creates tremendous stress on your immune system and overall physiological balance. When these fevers develop, they're frequently accompanied by drenching night sweats, general discomfort, and feelings of overall illness that can't be easily explained. Unlike viral infections that typically resolve within 1 to 2 weeks with rest and supportive care, these temperature variations tend to persist stubbornly or return repeatedly over extended periods. Sign number 4. Dangerous blood coagulation issues. Among the most frequently overlooked and seriously underestimated pancreatic cancer complications is its profound impact on blood clotting mechanisms throughout the body. While most people naturally associate cancer with visible tumors or persistent pain, very few realize that pancreatic cancer can silently establish ideal conditions for dangerous, potentially fatal blood clots. This medical condition, known scientifically as hypercoagulability, means your blood clots much more readily than normal, especially in the deep veins of your legs where circulation is naturally slower and blood can pool during periods of inactivity. Deep vein thrombosis, DVT, frequently results from this condition, typically presenting as unexplained leg swelling, noticeable warmth, persistent tenderness, and distinctive reddish or bluish discoloration in affected areas. While these symptoms may initially seem relatively minor or easily attributable to other causes, they harbor hidden dangers that can prove fatal if left untreated. If portions of these clots break away and travel through your bloodstream to your lungs, they can trigger pulmonary embolism, an absolutely life-threatening medical emergency requiring immediate intervention. This complication kills thousands of people annually and often strikes without warning. This process proves particularly alarming due to its underlying biochemical causes. Pancreatic cancer releases specific inflammatory substances that significantly disrupt your body's natural clotting balance, dangerously favoring excessive clot formation over normal blood flow. This creates internal perfect storms where dangerous clots can silently develop without any warning signs until they become life-threatening. Pulmonary embolism warning signs are unmistakable and should never be ignored or dismissed. Sudden, severe breathing difficulties, sharp chest pain that dramatically worsens with deep breaths, and rapid or irregular heartbeat patterns. When these symptoms occur together, they demand immediate emergency medical care, as minutes can literally determine life or death outcomes. Sign number 5. Gallbladder and liver enlargement. When pancreatic cancer develops and progresses, it creates serious cascading effects throughout neighboring organs, particularly affecting your gallbladder and liver function. These anatomical changes occur because pancreatic tumors frequently obstruct bile ducts, the vital pathways responsible for carrying bile from your liver to your small intestine for fat digestion. Your gallbladder, normally approximately pear-sized, can become noticeably and abnormally enlarged when bile backs up and accumulates. This enlargement happens because your gallbladder continues storing bile but cannot release it properly due to tumor-related blockages. This backup creates pressure and swelling that can be detected during medical examinations. Similarly, your liver might gradually swell as bile builds up within its tissues and structures. This hepatic swelling can sometimes be detected during physical examinations, appearing as firm, abnormal enlargement beneath your right rib cage that wasn't previously present. Modern imaging techniques like CT scans, MRI, and ultrasounds can clearly reveal these structural changes, providing crucial diagnostic information. These organ relationships are delicate and intricately interconnected. When one system becomes affected by cancer, it creates domino effects that systematically impact others throughout your abdominal cavity. Understanding these anatomical connections helps physicians assemble complex diagnostic puzzles and identify patterns that might otherwise be missed. Healthcare providers frequently check for these organ changes during routine examinations because they provide crucial indicators of underlying pancreatic problems that require immediate attention. Sign number 6. Persistent intestinal gas and abdominal distension. Pancreatic cancer can significantly disrupt digestive comfort in unexpected ways that are initially unrecognized by both patients and healthcare providers. The pancreas plays absolutely key roles in producing essential enzymes that help systematically break down fats, proteins, and carbohydrates, ensuring smooth digestion and optimal nutrient absorption throughout your digestive tract. When tumors develop in or around your pancreas, they can systematically interfere with this delicate digestive process, leading to persistent, unusual fullness sensations and uncomfortable bloating that doesn't respond to typical remedies. Among the earliest and most telling indicators is early satiety, the concerning sensation of feeling completely full after consuming only small amounts of food. This occurs because growing tumors can physically press against nearby structures like your stomach or small intestines, limiting available space and significantly altering normal digestion patterns. Consequently, previously normal meals can suddenly leave you feeling uncomfortably bloated, tight, or slightly nauseated, even when you've eaten much less than usual. This creates a concerning cycle where you eat less but feel worse, leading to unintentional weight loss and nutritional deficiencies. Unlike typical digestive discomfort from occasional overeating or minor stomach upset, pancreatic cancer-related bloating tends to be persistent, stubborn, and unresponsive to common treatments. It often doesn't respond to over-the-counter remedies like antacids, digestive enzymes, or dietary modifications that normally provide relief. Your abdomen may feel noticeably swollen even without eating, and these sensations can persist throughout entire days, becoming increasingly difficult to ignore over time and significantly impacting your quality of life. Sign number 7. Distinctive abdominal and back discomfort. Pancreatic cancer pain location and characteristics can reveal crucial information about tumor location and progression. When cancer develops in the pancreatic body or tail, patients consistently experience distinctive discomfort types that are difficult to ignore and unlike other common pain conditions. Imagine a dull, persistent, aching feeling that seems to originate from deep within your upper abdomen, behind your stomach area. This pain often extends or radiates to your back, creating distinctive band-like sensations across your entire torso. Unlike typical stomach aches or heartburn, this discomfort characteristically tends to intensify after meals or when lying flat on your back. Your pancreas sits within complex networks of nerves and organs throughout your abdominal cavity. When tumors grow and expand, they can physically press against surrounding structures, triggering persistent pain signals that travel along nerve pathways. Some patients describe distinctly gnawing sensations, while others compare it to constant heavy pressure or a deep, boring pain. The temporal pattern of this pain proves medically significant. Initially, it might appear intermittently, providing temporary relief periods that can be misleading. However, as the disease systematically progresses, pain often becomes more persistent, intense, and unresponsive to standard pain management techniques. Understanding your pain's specific characteristics helps physicians differentiate between pancreatic cancer and other conditions with similar symptoms. The precise timing, exact location, and distinctive nature of the discomfort provide valuable diagnostic information that can expedite proper diagnosis. Sign number 8. Dark-colored urine changes. Your urine color can tell powerful, revealing stories about your internal health status. When pancreatic cancer develops and progresses, it frequently affects your bile ducts, leading to a serious condition called obstructive jaundice. This occurs when bilirubin, yellowish compounds produced during normal red blood cell breakdown, accumulates abnormally in your body tissues. Normally, bilirubin is efficiently processed by your liver and eliminated through stool, giving bowel movements their characteristic brown coloring. However, when pancreatic cancer blocks bile ducts, this carefully regulated system becomes seriously disrupted and backed up. Even with completely adequate hydration, your urine might develop distinctive dark yellow or brown shades similar to cola or strong tea colors. This dramatic change happens because your body desperately attempts eliminating excess bilirubin through alternative routes when normal pathways are blocked. Many people unfortunately dismiss this obvious symptom, incorrectly attributing it to dehydration, dietary changes, vitamin supplements, or medications. However, if this abnormal coloring persists beyond several days despite proper hydration and dietary considerations, it warrants immediate medical attention and thorough evaluation. This distinctive discoloration often appears before other visible jaundice signs such as yellowing of skin or eye whites become apparent. Understanding this early warning sign could prove absolutely crucial for early detection and potentially life-saving intervention. Pancreatic cancer often remains devastatingly silent, but its impact throughout families and communities is anything but quiet. What makes this disease particularly dangerous isn't just the cancer itself, but how easily its symptoms can be ignored, dismissed, or disguised as harmless digestive problems, normal fatigue, or simple daily discomforts that everyone experiences occasionally. Yet, as we've systematically discovered throughout this presentation, these signs are far from ordinary or insignificant. They represent your body's quiet but persistent alarms, desperately attempting to communicate that something is seriously wrong and requires immediate attention. By recognizing even several of these early symptoms, whether dark urine, unexplained exhaustion, sudden bloating, or persistent back pain, you may provide yourself or your loved ones the most precious advantage possible. Time. Time to seek professional assistance. Time to act decisively before it's too late. Time to fight back against this silent killer. The fundamental reality is that knowledge preserves lives, and sharing that knowledge can save even more families from devastating loss. If this comprehensive video helped you understand hidden pancreatic cancer signs, imagine how many others could benefit from this potentially life-saving information. Please subscribe to our channel, activate notifications, and help us continue spreading critical, potentially life-saving health information to communities worldwide. Thank you for watching, and remember, your awareness today could literally mean someone's survival tomorrow.